How well prepared for a potential second wave are we in Dorset? Well, we can talk to Alyson O'Donnell, who is the medical director at the Royal Bournemouth Hospital, who joins me on the line now. Alyson, good morning.
Good morning, Steve.
We spoke in the kind of the midst of the first wave. I got the sense that things maybe changed back to some semblance of normal in the intervening months. How ready are you for a second wave?
Well, I think it's fair to say, Steve, that we've never stopped preparing, expecting that we would see Corona beginning to rise again at this time of year. And all the health services and social care services across Dorset have continued to work hand in glove over the summer to make sure that we're in the best place we can be going into winter.
And what does that mean then? So as we come into this flu season, this time when people come indoors and start to get a bit closer together and it's very easy for coronavirus to be transmitted, are you clearing out beds? Are you stopping any elective treatments in the same way that you did back in February, March of this year?
Well, I think that's actually going to be one of our biggest challenges, Steve, that we can't empty the hospital in the same way that we did, and the hospitals have done a really good job of picking back up with the elective treatment for people with serious conditions, but we are constantly looking at how we prioritise work. We are balancing that with the need to keep safe distances between patients, and making sure that we're able to effectively test and track all those people who come into the hospital who potentially have got coronavirus, to make sure that those who are coming in to have elective procedures are safe and not being exposed to the virus.
Right, because there were all sorts of stories during those first peak months of the pandemic about people, maybe not being able to get the kind of, say, cancer treatment that they had been getting. And I'm guessing if you had to say to those people, well, look, you're going to have to wait it out again another 3-4 months while we get through this difficult period, that could be damaging to their mental health and also realistically to their physical health as well.
I think that's something we've all been really worried about the non-COVID related harm that potentially our population will be exposed to. But I think we have a really good news story about cancer in Dorset, in that we really were able to keep going with our cancer services pretty much as we were pre-COVID.
Oh, really?
So those people who needed treatment received treatment all the way through. We did have to change some of the pathways that we used to keep people out of hospital, but everyone who needed treatment got treatment. And we were actually at a position where our referrals for potential cancers had really declined, significantly. A very small percentage of what they would have been normally, and actually we're back up to normal levels again. So we're managing that fine, but it was people who have got things that are important to them, that are chronic, but where they don't need to be urgently treated. Those are the people whose waiting times have really been affected,
Yeah.
and we know that that's got a big impact on people in their lives, and we want to try and minimise that where we can.
Patients obviously one part of what you do. You've also got this incredible and challenging role of juggling an impressive staff down there in terms of what they do and in terms of numbers as well. I'd like to talk a little about that if I can, Alyson. Did the hospital learn much from those first few months of the pandemic that means that these potentially difficult next few months might be, slightly easier? Are you able to better deal with coronavirus now?
I think we learned lots. I think in terms of managing the coronavirus, yes, we did. I mean, there's some really impressive statistics if you look at what happened in terms of those with the most severe disease and how many people were dying right at the beginning of the pandemic towards the end of that first wave, where the death rate more than halved from around 30% of those who went to intensive care to less than 15%. And actually in Dorset, we did well. We were at the lower end of that all the way through. So we've got much better at treating patients. We know your listeners will have heard about dexamethasone and hydrocortisone. We learned that actually patients were better if we could avoid ventilating them where possible, and managing their breathing difficulties in different ways. So we've learned lots from how to manage patients, but we've also learned lots about how to make the system work. So there are things that we did first time round that we probably won't do in quite the same way next time, because of the impact on other services, and that's where it's been so important for you're well aware that next Thursday, Royal Bournemouth and Poole Hospitals cease to be separate entities and become University Hospitals Dorset. So the two hospitals have been working really closely together to think about how we plan best to serve the population of East Dorset in the best way that we can, and learning from what went well first time round and what we might do differently.
I'm glad you mentioned that. We tied ourselves in knots deciding how to introduce you this morning, Alyson. We went with Royal Bournemouth Hospital for the time being, and we'll worry about changing it next week. And just a final thing then, there's been a lot talked about last week about the challenge that people have had trying to get tested, and I guess many of your staff will be in a situation that they are members of the public too, and they might well wind up having coronavirus type symptoms or having members of their families who do, and they'll need to be tested before they can potentially return to work. Are you expecting that to hit you at all?
We're already seeing it, Steve. The demand for tests has really increased quite dramatically in the last couple of weeks, and the team are managing that really well. But it is more difficult. It is getting the results back in a timely way to people so we can get them back to work. That's proving quite challenging. So again, the team are working on how we get that into as good a place as we can as quickly as possible.
Right. I guess that could be, that could potentially be your undoing. If those tests continue to be difficult to come by, then you'll have to be operating with a significantly reduced number of staff.
Well, that's something we absolutely would want to avoid, and that's why we need everybody to do their bit for us, really, so that if people are contacted by the Test and Track service because they've been in contact with somebody, please be isolated. If you've got symptoms, please don't go out in public. We know that for lots of young people, this is an illness where they may not have symptoms or they may have very mild symptoms, but that doesn't mean that they're not passing it on to people who can become really ill. And I think just before I come on, you said that we're sort of 6 weeks behind Spain, or we're roughly 6 weeks behind Spain. And if we learn from them, what happened was that the number of infections began to rise quite quickly in younger people, and that impacted a little bit on hospital admissions, but not quite so much in intensive care and the number of people dying. But what has now begun to happen in Spain is that the number of people in the older age group who are at risk of really serious illness and dying is beginning to go up. So there's some salutary lessons there for us that we have to watch, where people are a little bit ahead of us, what's likely to happen. So we need everybody to do their bit. And my other plea for everyone is that, flu vaccination is much more widely available this year than it ever has been. And we would really encourage people to take up the flu vaccine, because that is something that will also help us a lot.
Alyson, we'll keep talking. Really appreciate you making the time for us today, and good luck with everything significant happening next week as well. Alyson O'Donnell, Medical Director for now at the Royal Bournemouth Hospital. BBC.